Today I'm going to be interviewing Ms. Mika Wax, who is a nurse practitioner at UCSD Hospital and has been working there since 2001, and she is also my mother. So question 1, how many hours do you work in a typical week?
So typically I work between 85 and 90 hours a week, depending upon the work that needs to get done. My days usually starts at about 7 a.m. And I usually am done with work at about 4 to 5 p.m.
Okay, question number 2. What other healthcare professionals do you work with?
Since I work at a major teaching hospital, there's a variety of professionals there. I work with other physicians, other nurse practitioners, physician assistants, registered nurses, phlebotomists, nursing assistant, administrative assistant, and there's other various healthcare professionals with us.
Okay, question number 3. If I were interested in pursuing your career, what classes do you think I should be taking in high school? What extracurricular activity should I pursue?
So I think in high school, take any medical related classes, even if you do not feel you might not be interested in them or might not sound interesting, because you won't know until you take the class. I thought when I first started that I would want to be in the medical profession working with kids, and right now I work with adults who have cardiac complaints. So you just never know. So take advantage, take any healthcare classes, volunteer in an area you may think you might be interested in the future. That way you can at least get a little bit more background, a little bit more of what that profession really entails.
Okay, question number 4. Tell me about your background, including education and experience.
So I received my bachelor's as a registered nurse at San Diego State, moved to Orange County and received my master's at UCLA, and that's where I received my nurse practitioner degree. I worked immediately after graduating at Harbor UCLA, which is a county hospital in Los Angeles, and then after 4 years moved to a private cardiology office specializing in general cardiology, also people that had heart attacks, which is interventional cardiology, also people that had different heart rates, fast heart rates, slow heart rates, which is electrophysiology. All of them encompass cardiology. After that, I moved to San Diego, where I've been in the past 10 years at UCSD focusing in cardiology, but specifically electrophysiology.
Okay, final question. Describe the activities in a typical day in your job.
So because I do work in La Jolla, I typically start my day at 7 in the morning, filling patients' prescriptions, answering what we call patient portals if they want to send me questions, medical questions that they have, that they need advice on. I will start that. And then I usually will go up to the hospital and discharge patients, and that usually starts at about 8 o'clock. Usually it takes me a couple of hours to discharge all the patients who had the procedures the day before. And then I go downstairs and see patients in clinic, usually starting at about 9 to 9:30, depending upon when my first patient is scheduled. Some days of the week I have a half a day clinic, other days of the week I have a full day clinic. When I have a half a day clinic in the afternoon, I'm finishing up my charting, answering patients' phone calls that have called me, and basically putting out fires, things that need to be addressed. If I have a full day clinic, I'm seeing patients till a little after 4 o'clock. So after I'm done with my charting, I do leave and I'll return patients' calls the next day.
Okay, thank you, Ms. Wax. That is all we have for you today, and thank you for your interview.
All right, thank you, Ms. Wax.